Hi, this is Joseph Pate, better known as Medicare Joe, and in today's video we're going to talk about why I always recommend adding the hospital rider and cancer rider to any Medicare Advantage plan, so stick around. Welcome back. Again, this is Medicare Joe, and in today's video, we're going to talk about why I always recommend adding the hospital and cancer rider to any Medicare Advantage plan. So if you have an appointment coming up with one of our agents here to discuss a Medicare Advantage policy, or you're coming to us from YouTube, you stumbled upon our page, you're going to want to watch this video in its entirety. It's going to go over the two main exposures that a Medicare Advantage plan has. If you'd like to be updated as we post new Medicare videos, update videos, click the red subscribe button in the bottom right-hand corner. That way you'll be notified as we post new Medicare videos here on our channel. So let's dive into the actual content for today in talking about Medicare Advantage plans. And the number one thing that I see when I'm speaking with clients that are choosing Medicare Advantage is they're looking to keep their costs as low as possible on a monthly basis, typically, compared to going the Medicare supplement route. More information on that in the video link below, Medicare Advantage versus Medicare supplement. But for today's video, we're just going to go on Medicare Advantage and talk about how that works. So their main concern is trying to keep the costs as low as possible on a monthly basis. And there's a lot of benefits with going with the Medicare Advantage route. A lot of these plans have extra add-ons like dental, vision, and hearing, silver sneakers, gym membership programs, typically no copays for a primary care doctor, low copay for a specialist. There's a lot of benefits that a Medicare Advantage plan actually has for the client. And the bare bones coverage for most people, not receiving any Medicaid assistance, is going to be just their Medicare Part B premium, which is $164.90 per month. There's no additional premium for a Medicare Advantage policy. You just pay your Medicare premium, and that's it. And to kind of outline how a Medicare Advantage plan would look, and I'm not mentioning any carrier names or plan specifics, just due to compliance. I don't want to have any insurance companies coming after me. We're going to look at just like a sample of what a Medicare Advantage plan would look like. And this is how it's going to kind of break down. Your primary care doctor, again, is typically going to be free, no copay. Your specialist copay is going to be a $30 copay. Your copay for the emergency room is going to be $90. And then your physical therapy is going to be about $20 copay. So looking at these, they're not terrible. They're certainly doable copays, at least what we hear for feedback from most people. But the two biggest expenses that a Medicare Advantage plan has is number one, for the hospital stay, and number two, for cancer treatment, chemotherapy. So I'm going to illustrate how the hospital stay works with the Medicare Advantage plan first, and then we'll come back to how the cancer treatment works. So depending on the plan that you have, your hospital stay can range from $300 a night to $400 a night for typically the first 5 nights of a stay. So here's an example of that. If you're hospitalized on this plan here, you would have a $290 copay for the first 5 days of a stay. So that's each night you're paying $290 copay each night for the first 5 days. And again, leaving carriers out of this completely, this one here is a $370 copay per day for the first 5 days. Another one here is $360 per day for the first 5 days. So when you look at this, certainly one night in the hospital, okay, that's probably doable, right? Might be difficult, but probably doable to pay that copay. But if you're in there for even 2, 3, or 4 nights, you can see how this medical bill can start to add up. I mean, a 3-night stay, you're looking at about $1,000 right there. So most people that are choosing the Medicare Advantage route, they've picked this option, again, because they can't afford the supplement premium, or they didn't want to spend the extra $100 a month for a Medicare supplement, which I understand. But logically thinking, if we can't afford a $100 a month premium for a supplement, the chances are we're not going to be able to afford a $1,000 hospital bill as well, right? So what's the solution? And this is why I always recommend adding a hospital indemnity plan, also known as a hospital rider. So basically, the way that a hospital rider works is it's going to pay each night you're hospitalized. So let's just say, an example here, your copay is $300 a night for the first 5 nights of a stay. The hospital rider is going to mirror the benefits. So basically, it'll pay you $300 a day for the first 5 days of a stay. This means your actual out-of-pocket cost for a 5-night stay with the hospital rider is going to be $0. You wouldn't pay anything. So again, $300 copay per day. That's the plan cost. That's what you have to pay per night for the first 5 nights. The hospital rider is going to pay you $300 a day for the first 5 days. And that's of each stay that you go. No matter how many times you're in there, it's going to pay out that $300 per day. And this way, you don't have to pay any copay for your hospital stay. It's completely covered by the hospital rider. Now, the other concern for folks is when it comes to cancer. And with any Medicare Advantage plan that's out there, this is any Medicare Advantage plan, there is a 20% coinsurance for chemotherapy. So a coinsurance, similar to a copay, so a copay is a flat fee that you pay for a service. A coinsurance is actually a percentage of the bill that you'll have to pay. So if you have a 20% coinsurance, you're paying 20% of the bill. So here's a couple examples where you'll see that chemotherapy, 20% here on this summary of benefits. Here's another one, 20% coinsurance on this summary of benefits. So again, this is on any Medicare Advantage plan. If you grab your summary of benefits, it's going to be on there as well. So because cancer treatment is so expensive, when you think of 20% of the bill, what happens with folks that have to go through cancer treatment, or rather chemotherapy, on a Medicare Advantage plan, they're almost guaranteed that they're going to hit their out-of-pocket limit. So the out-of-pocket limit, if we think of what that is, that's if you took all of your copays or your coinsurance for the year, so your out-of-pocket expense, what you actually physically have to pay. If you ever hit your out-of-pocket limit, which usually ranges from $5,000 to $7,000 a year, you no longer pay any medical bills for that calendar year. So here's a couple examples of the out-of-pocket limit that you'll see on a summary of benefits. So this one here has a $5,400 out-of-pocket limit for the year. This one here has a $6,700 out-of-pocket limit for the year. So again, that is your cost. If you take all your copays and coinsurances and you hit that amount, that's when the insurance company now is going to take over and they're going to pay everything, but only for the rest of that calendar year. So your out-of-pocket, let's just say exposure or liability on either of these plans would be $5,400 or $6,700, depending on the plan that you're on. So one way that I've seen folks hit this number is with chemotherapy. I mean, the cost of chemotherapy is tens of thousands of dollars. So when you take into consideration 20% of that, you're going to hit that pretty easily. So, and not to mention, here's another example. Let's say someone's actually diagnosed in like July or August of one year, and they start their chemo in September. They hit their out-of-pocket limit, so they hit $5,400 for 1 year, and they're still doing chemotherapy in the new calendar year. They're going to hit the $5,400 again, right? So now they're paying just shy of $10,000 for that treatment as the new year cycled around. $5,400 out-of-pocket limit for 1 year, as well as for the following year, because they're still going through the treatment. So, because of this is something that I'm extremely passionate about and explaining it to folks, because I want people to be proactive and understand their coverages as opposed to being reactive and learning about their coverage after the fact. So with similar to the hospital copay and how there's a rider for that, there is a rider to cover this exposure for cancer, and it's called the cancer rider. And the way that it works is it basically will pay out a lump sum value to you when you're diagnosed with cancer. And you can choose the benefit level that you wish. You can choose a $5,000 benefit level, which we call the 1-year plan, because it's going to cover you for about 1 year of treatment. You can also get the $10,000 benefit, which is typically we call the 2-year plan. That's usually the most popular. And they also have a $15,000 benefit lump sum, which is the 3-year benefit. Basically covers you for about 3 years worth of treatment and hitting that out-of-pocket maximum. So that's how the cancer rider can pair with the Medicare Advantage plan. And the reason why I'm really passionate about these products is because of the cost of the riders. You can add these riders to any Medicare Advantage plan for as low as $30 to $35 a month. That's it. In theory, forget about the cancer rider. In theory, if you have one stay in the hospital overnight, the plan just paid for itself, regardless of if you ever get diagnosed with cancer. So, and if you're out there, if you're actually in the hospital for more than one night at any point during the year, you're actually benefiting from the plan. Again, regardless of if you get cancer. If you get diagnosed with cancer, this plan is going to help pay for all of that treatment. You'll be way ahead of the game. So what I want to do is I want to break this down, and I want to do more of a side-by-side comparison of a bare bones coverage of Medicare Advantage. So again, we'll look at the bare bones coverage of a Medicare Advantage plan at $164.90 per month. And now with this type of plan, you're going to have to pay your copay. So let's just say it's $300 a night for your hospital stay. And God forbid you're diagnosed with cancer, you're going to have to pay your 20% coinsurance up to your out-of-pocket limit. So let's just say the out-of-pocket limit for this example is $5,400. That's your bare bones coverage. Or how we've outlined these plans is kind of with like a tier system, and these are just our office tiers. These aren't actual tiers of plans. These are our office specific plans that we talk about here with our clients. You can go with what we call the bronze plan. Now the bronze plan is going to be about $195 a month. You're going to have the hospital rider included on there, covering that full hospital copay, so you don't have to pay it. And you're going to have the $5,000 cancer rider on there, which will cover you for about 1 year of treatment. So again, we call this one the bronze plan. Or the most popular one that folks have been picking is what we call the silver plan. And this is going to be about $205 a month compared to, again, the $164.90, which is your standard premium. So this is your total premium you'd be paying is $205. You'd have the hospital rider covering that copay, and you'd have the $10,000 cancer rider, which is going to cover you for about 2 years worth of treatment. And we believe that that's extremely important, again, because of the example I explained where people can have cancer treatment going from 1 calendar year into the next calendar year. And now they're hitting that out-of-pocket limit twice. Or the highest level of coverage is going to be your gold plan, which is still of value. This is going to be about $220 a month. And this is going to work in a way where your hospital rider is going to be covered, and you're going to be covered at a $15,000 cancer rider, which will cover you for about 3 years worth of treatment. So this is going to be your highest value option. Basically, with either one of these options, the bronze, silver, or the gold plan, you are eliminating the largest cost on a Medicare Advantage plan by just paying a little bit more in your premium and getting away from just having the bare bones coverage, the lowest premium. You're paying a little bit more to cover the unknown of what could come up. Now, a lot of my clients, when I go over this with them, they're like, okay, Joe, this sounds really good. And the most common question that I'll get is, I'm not anticipating a hospital stay, or I'm not anticipating getting cancer this year. And that's great. Nobody is, right? And they'll ask me, can I add this on, in a few years when I'm 68, 69, 70? And there's a kicker. And then that's the case with insurance. There's always a catch. So the idea with these plans is they are guaranteed issuing you into the plan at 65 with no health questions asked. So when you're turning 65 or just after 65 and a half, you can actually buy these plans with no health questions asked. After that window of time, let's say you are now 68 or 70 and you want to add these riders to your plan, you're going to be subject to answering the health questions and you may not be able to purchase it at that time. So we do run into that a lot where people are calling us back about getting these policies, and whether it was some type of health condition that popped up or pending tests or treatment that are coming up, they actually can't even buy the plan. So we are extremely important to add these policies if they're of interest when you're aging into Medicare, as well as their issue age plan. So what that means is when you're buying the plan at a 64-year-old rate or 65-year-old rate, they're locking you in at that age for your premium. So as the years go on, you're paying a lower premium for every year. If you wait to buy these plans, down the line, they're going to lock you in at a higher premium at the age at which you buy it. So they're issue age policies. So again, if you're watching this video and you have your appointment coming up with one of our agents, make sure to mention to them what level of coverage you're thinking of going with, whether it's the bronze, silver, or gold option. Whatever one you think is a good fit based on budget, on your one-on-one appointment with one of our agents, they're going to be able to give you exact pricing down to the penny of what that'll look like. And if you're already on a Medicare Advantage plan, again, either through us or, like I said, maybe you stumbled upon this video and you're interested in speaking about the hospital rider and cancer rider and the prices of how that works, reach out to us. You can call the number. I just put it up here on the screen here. You can call this number, speak with one of our agents. We can get you exact pricing on that and make your coverage with Medicare Advantage that much better. So again, I hope you enjoyed this video. If you did, if you could hit the like button, that would be great. The way that YouTube works is the more likes a video has, the more people it'll put it in front of, so that way we can educate more people on the topic of Medicare. And again, if you'd like to subscribe to our YouTube page, click the red subscribe button in the bottom right-hand corner, and you'll be notified as we post new Medicare update and news videos. If you'd like to leave a comment below, I personally go through those and answer them. So if you want to comment on this video, have any questions, be sure to drop a comment in the comment section below. Again, this is Medicare Joe, and I want to thank you for the time here watching our hospital and cancer rider and why we recommend adding those to any Medicare Advantage plan. Have a nice day.